When the nerve of a tooth becomes damaged or infected, root canal therapy is often the only way to save the tooth. Inside each tooth is a pulp chamber that contains the nerves and provides nutrients to the tooth. The pulp runs like a thread from the pulp chamber down through the root of the tooth. If tooth decay is present or if a tooth is injured, it's possible for the pulp to become infected. Without treatment, the infection can build up at the root tip, forming an abscess. An abscess causes pain, and it can even damage the bone that surrounds the tooth. When this occurs, the only way to repair the tooth is by removing the diseased pulp and then cleaning and sealing the inside of the tooth. This treatment is known as root canal therapy. Contrary to popular belief, root canal therapy is a relatively simple procedure with little or no discomfort. Most people report that the treatment itself is no more painful than having a filling placed. By having this procedure done, it's possible to fully restore your tooth with minimal difficulty. Root canal therapy may be performed by either your dentist or a specialist and usually requires 2 to 3 appointments to complete. In the first step, a local anesthetic is given to maintain patient comfort, and a small opening is made to provide access to the pulp chamber. Your dentist will then use special files to clean the infection and unhealthy pulp out of the canals. After this, the root is cleaned and shaped, and medication may be added to help destroy any remaining bacteria. A temporary filling is then placed to help keep the root free of infection or contamination. At the next appointment, the temporary filling is removed and the canals are filled with a permanent material. In most cases, further restoration is required to return the tooth to normal. If there is very little tooth structure remaining, a metal post may be placed inside for extra support. In the final step, a crown is placed over the tooth to provide added protection and stability. The final restored tooth is nearly identical to your other teeth and is just as strong. Your dentist will let you know if root canal therapy is the right treatment for you. There are some common symptoms that a person who needs root canal therapy may experience. If you notice any of these signs, tell your dentist immediately. Sensitivity or pain when drinking hot or cold liquids. Pain in a particular tooth when chewing. A lingering toothache that persists, requiring pain medication. A visible swelling near the root tip of your tooth. Pain that seems to spread or appear in other areas of the mouth. If you have any of these symptoms, it's possible that you may require root canal therapy. The only real alternative to root canal therapy is to remove the diseased tooth. Some people might decide to do this, thinking that it may be less expensive. However, this treatment option leaves the patient with a missing tooth, which can cause many more complications. Teeth need each other for support. When one tooth is missing, it can cause the surrounding teeth to shift, creating spaces in between the teeth and making it easier for plaque to accumulate. This may result in periodontal disease, a condition that can eventually lead to additional teeth being lost. In order to fill the empty space where the tooth was, a dental implant or a bridge may be required. These solutions ultimately end up costing more than root canal therapy, and you won't be able to keep your natural tooth. When possible, treating a diseased tooth with root canal therapy is almost always the best option, and with proper care, your restored tooth can last a lifetime.